Used to be a pretty boutique disease, if we're being completely honest. Hashimoto's disease used to be one of those things that was thrown around on the medical dramas that were making their way across television in the early 2000s. ER, House, that'd be about the only place that you'd ever hear of this stuff. But with the rise in autoimmune diseases that's out there, unfortunately, it's not all that rare anymore. So we should probably know a thing or two about this. Hashimoto's disease is an autoimmune condition in which the body attacks and destroys its own thyroid gland. Piece by piece, your body chews up and destroys your own thyroid gland as if it is an enemy. In a healthy immune system, antibodies act as the body's army to detect and destroy invaders not normally present in the body, such as bacteria, viruses, fungi, and parasites. In the case of Hashimoto's disease, a defective immune system wreaks havoc on the body by directing antibodies against its own thyroid gland, as if it is a foreign invader. Although Hashimoto's disease is considered a leading cause of hypothyroidism around the world, it is tragically overlooked disease in mainstream medicine. So what you might be thinking, my doctor has never diagnosed me with Hashimoto's disease. This post is not about me. Are you sure? Yeah, no, exactly. And then again, it's like, I have Hashimoto's disease because I weigh 400 pounds. Are you sure about that? Or is it because you subsist on a diet of ho-hos? Maybe, maybe not. You might have Hashimoto's disease and don't even know it. So let's figure it out. Have you ever gone to your doctor complaining of common hypothyroidism? Symptoms such as fatigue, weight gain, brain fog, muscle weakness, constipation, irregular menstrual cycles. I can guarantee I have not done that to my doctor. Frequent infections, dry skin, and hair loss. Boy, that sounds like it's literally everything, doesn't it? Have your thyroid lab tests come back normal and your doctor tells you that your thyroid is perfectly fine, yet you walk out the office without relief from the common symptoms? Have you had your thyroid antibodies tested? Are you sure? Now, exactly. And a lot of those other things we talk about as well with just common like nutrient deficiencies as well. Like there's a lot of crossover when it comes to that. Or just kicking carbohydrates out of your diet. That normally helps as well. According to the American Association of Clinical Endocrinologists and the American Thyroid Association, iodine deficiency is the most common cause of hypothyroidism on a worldwide basis. Yeah, no, exactly. There are areas of iodine sufficiency, such as in the United States. It's mostly because you have iodinized table salt. That's about the only reason why. But then you have an influx and rather over increase and overcompensation of sodium in most people's diets, which up to a point is fine. But then, yeah, you get a lot of people who just end up eating a box of salt throughout the entire day. It's not good for you, okay? You're not a horse. You don't need to chew down on a salt lick. In areas of iodine sufficiency, such as the United States, the most common cause of hypothyroidism is Hashimoto's thyroidosis. Despite the prevalence of Hashimoto's, thyroid antibodies are often not tested. You may have Hashimoto's and not know it. So, what the heck is it? Number one issue in the most traditional doctors do not test for thyroid antibodies. In mainstream medicine, TSH rules, leaving millions of Hashimoto's patients around the world undiagnosed and untreated, or even if there's millions of cases out there, but whatever. You must be the best advocate for yourself in insisting the following two thyroid antibody tests. Thyroid peroxidase antibodies or thyroglobulin antibodies. Interesting. You go ahead and you remember both of those. Doctors refuse to treat Hashimoto's when TSH is normal. What is THA? I blew over that paragraph. It's just your thyroid blood test called TSH. Okay, so it's a standard blood test. Okay. Another major problem is traditional doctors refuse to treat patients who test positive for thyroid antibodies, even if they suffer debilitating symptoms, all because their TSH level is normal. That's why you need to know about this stuff. It's possible the thyroid hormone levels circulating in the blood show up normal in your blood tests. However, the problem is they are not getting into the cell and taking proper effect. Your blood tests turn up normal, yet you have symptoms of hypothyroidism. You're taking thyroid replacement medication, but you still have symptoms of hypothyroidism. That's interesting. Are you on a thyroid replacement medication and your doctor insists your thyroid lab results are in the normal range, but you still don't feel well? Your doctor increases your dosage, you feel better for a short while, and then your symptoms come back again. Why do you feel sick? Even though your thyroid lab tests are normal. Or perhaps you're like many Hashimoto sufferers with TSH levels fluctuating high and low like a wild roller coaster ride with symptoms of hypothyroidism 1 month and hypothyroidism the next. Your doctor happens to catch your TSH level during a low point and decides to reduce your thyroid medication as a result, even though you suffer terrible symptoms. Why can't your doctor figure out why you are sick and tired? Well, it sounds like your doctor sucks, if we're being completely honest. Hashimoto's is a genetic condition. We inherit particular genes that can be triggered at certain points of our life to turn them on, like a flip of a light switch. Women in particular, oh my gosh, women most affected, tell me more, 3 different times in their life to turn the genes on. Puberty, pregnancy, and perimenopause. The 3 Ps, how adorable. And then when it comes to sexual selection, they also have another 3 Ps, parental investment, paternity, provisioning, and penis. Anyways, I was diagnosed with hypothyroidism following the birth of my first son. I wasn't, though. I was fine for the birth of my first son. Just kidding. With each pregnancy, my symptoms worsened. It sounds like a big cope on this one. Once these genes are turned on, the body begins producing antibodies against its own thyroid, and the destruction begins. In addition to the particular points in life, there are additional possible triggers for Hashimoto's. These same triggers, if left untreated, will also worsen the attack, and it kicks in the high gear. It is crucial to determine if one of these things is happening in your body right now. There's a must-read book for every person. I just want to know about what the symptoms are. Okay, so gluten intolerance. Well, you shouldn't be eating gluten to begin with. Gut issues, that makes sense. Adrenal dysfunction, stress, viral infections, parasitic infections, fungal infections. These are all causes as well, if the 3 Ps didn't catch you. Fungal infections, chronic inflammation, sex hormone imbalances, blood sugar imbalances, vitamin D deficiency, heavy metal toxicity, environmental toxicity as well. When you have autoimmune disease, you are at high risk of developing other autoimmune diseases such as type 1 diabetes, multiple sclerosis, celiac disease. Again, that would be a gluten intolerance as well. Addison's disease, she sounds like a nice girl. Cushing's disease, alopecia areata, you start losing hair, and then you get your husband to go up there and slap Chris Rock on stage. Sorgen syndrome, chronic fatigue syndrome, just sounds like you're lazy. Fibromyalgia, rheumatoid arthritis, pernicious anemia, systemic lupus, erythematosus, it's never lupus, sarcoidosis, scleroderma, vitiligo, and psoriasis. Although Hashimoto's disease is a leading cause of hypothyroidism around the world, well, actually, iodine deficiency is a leading cause. We already read that, but whatever. It is tragically overlooked disease in mainstream medicine. We already talked about this. Hashimoto sufferers often find little help with their doctors living decades with debilitating symptoms. Yeah, being fat and lazy. But again, it's a glandular problem. My thyroid isn't acting properly. Well, in some cases it is, but just get those enzyme tests and I'll help you out. Your whole body becomes fair game for attack, all while your doctor insists you are fine. And again, if your doctor's that boneheaded about running a simple test, you should probably just get a different doctor. But that's a different video. But as for right now, thank you all very much for the gift of your time. I've been Don Consuelo. I want you to follow your gut and get after it. Take care, everyone.